Welcome to all my viewers. Today's discussion will be on stillbirth. Now, pregnancy is a very big gift from the Almighty, and the person, the lady, the husband, the family, society, all the relations, everybody is very happy that there is going to be the next generation coming into the family. But suddenly what happens at about when she is 35 weeks or so, suddenly the patient complains that she is not able to feel fetal movements, and they come to the doctor and the doctor examines her, and we are not able to locate the fetal heart. There is no fetal movement. It's a very sad stage where the patient is very much upset. The family is upset, the doctor also is upset. So this condition of stillbirth has to be taken care of, and say there are about 10,000 pregnancies, there is about 2% to 3% which may happen. And what are the reasons for the stillbirth? Let us now see what are the reasons, and so that we can educate ourselves to prevent such a catastrophe happening in our life. Now, if the baby is lost by 20 weeks, after 20 weeks, it is termed as a stillbirth. But according to medical legal point of view, it is 28 weeks. When at 28 weeks, when she is about 7 months, if the lady loses her pregnancy, that is, there is an intrauterine fetal death, that means the baby dies inside the uterus, then it is termed as stillbirth. Now, before going into what are the reasons, from the legal point of view, it is a very devastating problem, in the sense the patient is affected, the parents, the mother, the husband is affected, the family is affected, and the doctor who has been looking after her also is affected. And it is one of the causes abroad, especially, which is now in India also, is that it is a case for litigation. So, health professionals and everybody should take care so that we don't land up in such problems later on in our practice. Now, what are the causes for this intrauterine fetal death, stillbirth? There are many causes. One, the cause, maternal point of view, that is the mother's problem. What are the maternal causes we have to see? So, the maternal causes are the very close marriage, consanguinity we say. When the parents would have married cousins, the girl also marries her cousin. So, there is a second generation of consanguinity taking place, where the certain genetic problems can come up, causing a problem of this intrauterine fetal death. So, that is one thing, and especially in our culture, where consanguineous marriages are still taking place, we must educate our society that repeated consanguineous marriages can cause problems like this. Then, when the mother is elderly, say she is about above 35 years, and we call it elderly primigravida, first time conception above 35 years can lead to, because the ovary may be aging, and so because of the egg which is aged, there can be certain problems and the development, and it can lead to intrauterine fetal death later on during the pregnancy. Then obesity is another problem. Now especially we have very young girls in the adolescence, lot of PCOS girls having PCOS, and this PCOS, one of the findings is that they are obese, and this obesity continues in their life also. So, this obesity can also cause a problem of intrauterine fetal death. Then the low socio-economic classes, that is malnutrition. Now, in some societies where there is not adequate nutrition during the pregnancy, especially the protein part of it, if it is not there, and they take high amounts of carbohydrates which is freely available for them, in such cases that also can be one leading cause. So, low socio-economic status of life can be, it is found more in such patient. Then in recent concepts, because of the culture, change in the culture, smoking, alcohol, drug abuse, all these also can affect the pregnancy and lead to stillbirths or intrauterine fetal death. So these are all the maternal causes. Now coming to the fetal causes, the causes in the baby which can be the reason for the multiple pregnancy. Now usually pregnancy is single, but sometimes there can be multiple pregnancy, two as a twin pregnancy or triplets or quadruplets, like that. If when the more number of babies, because of certain circulation problems inside the uterus, they can land up in intrauterine fetal death. Or in twin pregnancy we have seen one child will survive, the other child may die in utero. So multiple pregnancy is also one of the causes for intrauterine fetal death. Then congenital anomalies, that is that during development, because of some chromosomal reasons, there can be improper development of the baby, and this congenital anomaly can be one cause for intrauterine fetal death. Then fetal infection, now especially the torch infection, there are different infections, and especially the CMV, cytomegalovirus infection, or herpes, or measles, German measles, all these can lead to problems of the development of the baby, leading on to intrauterine fetal death. So these are all the fetal causes. Now some causes can be because of the cord, the umbilical cord from the placenta. The umbilical cord is there, which is attached in the umbilicus of the baby, near the umbilicus of the baby, through which oxygen, food, everything is supplied to the baby. So in that cord, in the umbilical cord, there can be certain problems. What are the problems that can cause because of the cord? One is that the cord may have a true knot. The baby keeps swimming inside, and it can cause a true knot by itself. So when there is a true knot and it becomes very tight, then this will restrict the amount of oxygen and blood flow and nutrition to the baby, and so that can be one cause. Then another cause is if the cord is around the neck very tight. So in the nuchal position and the cord is very tight, there also the baby is not able to breathe because there is something holding the neck very tight, and so that can be one cause for the intrauterine fetal death, which can cause is certain placenta. But before that, I wanted to mention about certain pregnancy complications which can cause fetal death. One is the intrauterine growth restriction due to some cause, either due to genetic or due to some restricted flow of blood through the umbilicus. There can be intrauterine growth restriction which is preceding the intrauterine fetal death, and later on I will tell you as to how we can overcome these and look after these complications. Then maternal trauma. Suppose the mother has a maternal trauma, either an accident or domestic violence at home, and there is trauma, then also that can lead to intrauterine fetal death. Then uterine rupture. Now sometimes what happens, the baby is very big and she may get into labor and the baby is not able to descend down. So there is pressure on the lower uterine segment, uterine part of the lower segment, and because of that the uterus may rupture and there can be fetal death. So very important monitoring in labor is very good, and if the baby's weight is above 3.5, we must take additional care as to how to deal with this big baby, macrosomia we call it, to prevent such problems of uterine rupture during pregnancy. Actually very strict monitoring is necessary to prevent uterine rupture. Then post-term pregnancy, those pregnancy which are beyond 42 weeks. Normally nowadays we allow but we induce So once they finish 41 weeks, we induce, because the placental function may not be adequate after 40 or 41 weeks or so. So careful monitoring again is very necessary, so that there should not be any placental insufficiency, which is the place which supplies the oxygen and the food and the nutrition for the baby. So as far as possible, to see that in case the pregnancy goes beyond 42 weeks, we must induce and see that she is delivered carefully, so that there is no trauma to the baby. Then uterine anomalies. Uterine anomalies are, sometimes it can, the uterus is a single structure, but sometimes that it comes, the uterus actually is formed from two different halves. So sometimes there can be a remnant of this fusion of the uterus. So there can be a bicornate uterus or a septate uterus, where the baby is not able to grow to full term, leading to intrauterine fetal death. So there are, now coming to certain problems, the medical disorders which may cause intrauterine death, that we have to also see. Now what are the medical disorders that can cause? Now diabetes in pregnancy, either a diabetic woman becoming pregnant, or in pregnancy she can acquire diabetes. So these problems can restrict the placental function, and so because of this it can later on, if not monitored well. So especially in diabetes earlier, because of improper treatment and not monitoring them well, there were many fetal deaths, intrauterine fetal deaths. But now with good, especially after the DIPSI program has been established throughout India, good monitoring. That is why we say whenever a lady is, acquires pregnancy, she should be tested for her blood sugar level, and we must see to it that her blood sugar level in pregnancy, fasting is kept below 90, and 2-hour level should be less than 140. So if this, and in pregnancy sugar monitoring should be done every trimester. When once pregnancy is confirmed, she must have early diagnosis monitoring, and repeated monitoring, and universal. Those earlier days we said only if there was history of diabetes in the family, then she was monitored. But now as a routine, it should be universally monitored. Everybody should be checked for blood sugar in monitoring in pregnancy and at each term. Similarly, PIH, pregnancy induced hypertension. So that is another cause. Because of the high blood pressure, a lady may suddenly go in for intrauterine fetal death. So every visit in pregnancy up to 28 weeks, every week, every month a lady must be checked once a month. From 28 to 32 weeks it is once in 15 days, and from 36 weeks onwards it's every week. So every week, every time that she comes for her checkup, blood sugar should be monitored, blood pressure should be monitored, and urine for proteinuria also must be checked, so that we are aware. And now with recent good ultrasonogram findings of fetal ultrasonogram, we are able to predict PIH coming even as early as about the 20th week itself. So with all these good tests that are available, it is easy to take care of the lady's blood pressure and see that her pregnancy induced hypertension is looked after and maintained, so that she does not lose her baby because of the pregnancy induced hypertension. Then similarly, there is another problem which can cause, one is the chronic renal problems. Suppose she has nephritis, kidney problem, then also there are chances that, so adequate maintenance, adequate care, frequent monitoring will go a long way. And another thing which can, which we are worried is about thrombophilia, one condition. What is thrombophilia? That means she can have bleeding diathesis. That is, normally the blood should clot at so many minutes, but sometimes they have bleeding problems. So if she has thrombophilic, for that is why antenatally we must check her blood clotting time, bleeding time, platelet, PT, INR, all that is usually done, so that we are sure that she does not have any thrombophilic problems which can cause sudden problems for the baby and lead to death of the baby in utero. Then one more problem is about the placenta. Now the placenta is the main organ from which through the umbilical cord we get the supply of oxygen and things. So sometimes it can have insufficiency. Placental insufficiency can be a cause, or there can be a separation of the placenta. Normally baby is delivered and then the placenta is separates. But sometimes because of pregnancy induced hypertension or because of some trauma, the placenta can separate earlier. It is called antepartum hemorrhage, and in that abruptio placentae is one thing. So this can lead to problems for the baby because blood collects inside and the baby can die because of less of blood supply to the through the umbilical cord. So abruptio placentae, antepartum hemorrhage is part of the antepartum hemorrhage. So this can be one other cause for thing. Same way, infections in the mother, whether it is measles or high fever or diabetes leading on to ketoacidosis, sepsis, all this can be another cause for intrauterine fetal death. Now intrauterine fetal death is a very problematic has a play in pregnancy, because the baby, if it dies inside, can cause certain problems for the mother. So early diagnosis, now especially with scan, we are able to find out. Otherwise only by fetal movements we knew and fetal heart monitoring. But now with scan we are able to find out there will be certain changes in the structure, the appearance of the baby. One thing is that the skull bones will become closer, called the Spalding sign. So all these things will prove that the baby has died in utero. And once it is confirmed, intrauterine fetal death is confirmed, there should not be any delay, because the longer the dead baby fetus is inside the uterus, it can cause certain problems for the mother, toxic problems for the mother. So planning on delivery should be. There are good medicines by which we can induce labor and deliver her, but if it doesn't work and if her parameters of bleeding time, clotting time, PT-INR, all this is increasing, then we should decide that we empty the bladder, empty the uterus as soon as possible. So stillbirth is a very dangerous problem. Not only physically it affects the mother, but it causes a lot of mental trauma for the mother, the family, and as I said, for the person, for the doctor who has been looking after her. So prevention is better than cure. So we must know what are all the reasons which can bring about intrauterine fetal death, and see to it that we take great care so that no mother should lose her baby during her pregnancy, and see to it that there is joy given to the mother, the family, and a joy of delivering a healthy live baby for the obstetrician also. So this is about stillbirths or intrauterine fetal death.